Hello, it's Dr. Kaki. How can I help you today? One of the things that underpins my life has been my faith. Being a Muslim, the fundamental core teaching is actually two things. It's worship the Creator.
Are you taking any medicine that thins the blood?
Thank Him for everything you've been given, but also serve the creation, serve humanity.
There are about 17,000 people in hospital with COVID.
Good morning. Hi guys, how are you? Hi, is Mrs. Kosa there? Engaging ethnic minorities is always a huge challenge because there are so many taboos they face. That scan shows that she's got quite tight spine at the back. They have a huge amount of concern about discussing health issues generally. It's seen as a weakness to have illness in any way, shape or form. You may have a cancer or you may have mental health concerns, but it's almost hush hush, let's not discuss that. It needs a bit more of a discussion, but I definitely think if anyone has a new cough, we should definitely be thinking about coronavirus. The COVID-19 virus really wreaked havoc in these communities, and a lot of ethnic minorities work in key frontline roles. They are the cashiers, they're the bus drivers, they're frontline healthcare workers, and a lot of them live in multi-age families. They've got a lot of elderly relatives who live with them. They then have a high chance of transmitting this virus amongst themselves. And of course, they tend to have this community feel, so they always meet up together, lots of families. You know, this year's been so tough for you.
Yeah.
I wanted to see how you're doing. How are you feeling from a sort of mental health side?
Oh my God, what can I say?
Yeah. Like you said, that sometimes you do feel a bit depressed.
Well, I'm completely ignorant about those things now. But sometimes, as I say, it was a matter of family sometimes.
Sure. And is that calmer now? Is that better?
Well, that I don't think too much about it now.
Fine. Okay. The fact that ethnic minority communities don't engage meant that a lot of them may develop longer term comorbidities as well, which can also contribute to COVID-19. Feet are looking much better. Have you been
I keep washing.
Have you been moisturising them with that cream we gave you?
Yeah, but
good. Can I have a look at the other one? Here, pull that here.
so it's okay.
That's okay.
That's why I didn't put the socks this time.
Yeah, thank you. That's good. So a little bit of dryness here, but let's have a look. Hey, perfect. Almost perfect. Shall we have a listen to your chest? Yeah. Just to make sure we're not missing anything. I'll just get my gloves on. What we found was many of them didn't want to talk about it. Many of them would say, maybe call me and say, Dr. Kaki, look, I've got COVID-19. My aunt's got it, my uncle's got it. Please don't tell anyone. But what should I do? I want to seek advice, but don't tell anyone from the community. And of course, I'm bound by confidentiality. I can't tell anyone anyway. There is a real concern about being seen as vulnerable, and that was a taboo that we really needed to address, but continues to pervade the community.
Yeah, exactly.
Oh, hot box, okay, fine.
My father is my biggest role model. He has done something that I've seen rarely in other people, which is he really walks the talk.
Nice, huh? That's nice.
He lives the message of helping other people. He's been doing international relief and aid work for so many years. Even when I started doing it myself, he was actually my first trainer.
Shows you how many tablets they take. If you pass by, it'd be nice to see you then, okay? Lovely. Thank you. Take care. Bye. Bye.
Seeing him in those environments, and then when I go to see him in the pharmacy, I see the way he interacts with patients. He's always laughing, he's always supporting them, he's smiling, he's cheering people up. And I think when I saw that firsthand, I thought, wow, that's the kind of person I want to be.
It's my son, Mo.
Oh,
Yeah,
my goodness.
yeah. How are you guys?
Hi, we roped you in.
Lucky to have such a good daddy, believe me.
Very lucky, yeah.
Very lucky.
Now we know where he gets the good looks from.
Well, and the charm. Yeah.
Thank you so much, that's brilliant. Thanks a lot. Lovely to meet
Take
you.
care.
Good luck. Take care. Bye. Thank you, Kim.
From Global's newsroom at 11 o'clock. o'clock, it's feared COVID restrictions, which have thrown Christmas plans up in the air for millions of people, may have to stay in place until vaccines are rolled out. A new tighter Tier 4 levels come in for London and the South East, parts of eastern England and Wales, due to rising infections fueled by a new strain of coronavirus, which spreads quicker. It effectively reasserts the November lockdown. That's no mixing between households and non-essential retail closes.
Birthday to you. I'm so sorry, I can't hug you, I can't be with you.
But we'll cut the cake and then we'll drop some to you, Mummy. Yeah?
Yeah, no problem. Enjoy the day and enjoy the food.
Yeah, thank you.
Enjoy.
Happy birthday to you. Bye. Love you.
Bye. Bye.
My first love is football. That was something I always did, and actually when I was younger I had the opportunity to become a professional football player, and my mother had a lovely word with me and said, I think medicine will be better for you, which is perhaps typical of an Asian mother, but I think in the end it was a really good decision, partly because I never grew any further from that point, but I think also the opportunity to serve humanity is so vast in medicine. In 2020, we've seen COVID-19 really affect so many communities. We have a food drive, we have a food bank that is attended by not just homeless people, but people who are suffering. We're in one of the wealthiest cities, in one of the wealthiest countries in the world. How is it that we're seeing so much poverty and so much suffering in the streets here as we do abroad? It doesn't make any sense. I'm here in London. It's sometimes understandable in the middle of a war zone, but it's not understandable in a first world country. And I think one of the things we need to do as we go through reflecting all the work we do abroad is also think about our own situation and how we can remedy that. I think a lot of people who are Muslim, who are part of our organisation, because of course the organisation has Muslims and non-Muslims, have found that this has been a really great way for them to express their faith as well.
Would you like some cake?
Some water. Do you take chili? You know, the black, Asian, minority ethnic community, we've been in many ways the most targeted by this virus, most affected. We've lost so many lives.
And they were like, when we were praying, they'd stand over us and make sure that we were okay.
Amazing.
Yeah, acts of humanity is incredible.
Thank you. So how much have we really taken from the pandemic? What have we really learned from it? There was one meme where it was like, Satan is mocking God. He's like, I've closed all your spaces of worship. And God is like, yeah, but now I've made every house a space of worship.
Exactly, yes.
Right? So at the beginning, that was a really positive attitude. You know, what do we want to change our behaviors, our collective and individual behaviors? What are we learning about what's important to us?
I found uncertainty is always the thing that makes people really, it challenges them. They find it so difficult to deal with because they have nothing to hold on to.
We also have a community that is quite senior in age, so they're very reliant on receiving information from other people. Maybe English isn't their first language. And all of these things have played into a large amount of skepticism towards the vaccines that have been produced.
I guess now is the time for the leadership, the scholars, to actually step up in terms of how we disseminate the correct information.
We've had dedicated programs with epidemiologists, with virologists, people who are experts in public health, as well as imams who can communicate that message in a language that is going to be amenable to the community, that they can understand and have a space to ask the questions. Sami Allahu liman hamidah, Allahu Akbar.
Stand by, everybody. In 5, 4, 3, 2, 1, in Q mode.
Hello and welcome to Dr. Mo's Happy Clinic, the Male Plus program looking at some of the many ways we can boost our mental health. I'm Dr. Mo Kaki. My role as a media doctor is very important, I think, to challenge a lot of stereotypes. When I was growing up, there weren't many ethnic minority figures on TV who I could draw upon as a source of inspiration.
We are introducing a points-based system, and today we have published more details of that system.
When I saw our Home Secretary, Priti Patel, decide that we have to close the doors to the UK, I don't think there are words that can express how I feel about that.
Freedom of movement will end after next Thursday. Trading with the EU won't be as easy as it was.
Priti Patel and myself have both been born in the UK. We've grown up in the system, and yet Priti Patel has become the Home Secretary and has decided to exercise a harsh immigration policy. One of the biggest ironies of this COVID-19 crisis has been that when our Prime Minister, who is leading us out of Europe, became sick with COVID-19, his care was delivered by nurses who, after Brexit, will no longer be able to come into the country to help and support us. When it comes to being unwell, we're happy to receive care from anyone. But when it comes to recognising those workers, are we still happy to do that? The racism that we have engendered and allowed to grow is much more dangerous than COVID-19 has ever been. Multiple times throughout the last year, I have got to a point where I feel just exhausted. And you carry on because it's the right thing to do, and you carry on because the system needs you, and you carry on because colleagues are off unwell, or you know the system hasn't got the resources without you. But I think there's a point where you have to pause and take time out. No fever? No. Have you ever had an allergic reaction to anything? No. Have you ever taken an adrenaline injection? This is all the information for after, okay? So what we're going to do now is, I'm going to ask you to go to this zone and wait for 15 minutes. Go out and use your time to help other people. Go out and serve them. Go out and do some charity. Go out and smile at someone. Do whatever you can to make someone else's life better, and that's a life that's worth living, that's a life that's fulfilling.